Hello and welcome to this video. I'm going to take you through hyperthyroidism or thyrotoxicosis. Hyperthyroidism or thyrotoxicosis is a clinical syndrome caused by an excess of circulating free thyroxine and free triiodothyronine, or both, characterized by increased metabolic rate. So thyroxine is known as the T4, then triiodothyronine is known as the T3. Causes of thyrotoxicosis or hyperthyroidism. So we have Graves' disease. This is the most common cause of hyperthyroidism. It is an autoimmune disorder where the body's immune system mistakenly attacks the thyroid gland, causing it to produce too much thyroid hormone. We also have thyroid nodules. So these are lumps or abnormal growths in the thyroid gland that can become overactive, producing excess thyroid hormones. These nodules can be single or multiple. When they are single, we refer to them as the solitary toxic adenoma. When they are multiple, we refer to them as toxic multinodular goiter. The third cause is thyroiditis. Thyroiditis. So this is the inflammation of the thyroid gland, which can cause stored thyroid hormone to leak into the bloodstream. The types of thyroiditis that can cause hyperthyroidism includes subacute thyroiditis, postpartum thyroiditis, and silent thyroiditis. We also have excessive iodine intake as one of the causes. Iodine is essential for production of thyroid hormones, but too much iodine can cause the thyroid gland to produce too much thyroid hormone. This can happen due to diet or medications that can contain iodine. So other causes includes pituitary adenomas. So although this is rare, benign tumors of the pituitary gland can produce an excess of thyroid stimulating hormone, leading to overproduction of thyroid hormones by the thyroid gland. Then another cause is functioning thyroid cancer. So this is also rare, but some thyroid cancers can produce thyroid hormone. We also have medications as one of the causes of thyrotoxicosis. So certain medications such as amiodarone, which is a heart medication, can cause the thyroid to produce too much thyroid hormone. Then the last cause that we can look at is excessive thyroid hormone intake. So taking too much synthetic thyroid hormone such as levothyroxine for hypothyroidism can lead to hyperthyroidism. So these are some of the causes of hyperthyroidism. Pathophysiology of hyperthyroidism. Excessive thyroid hormone secretion leads to hyperthyroidism. This is what is called thyrotoxicosis. The thyroid hormone increases the metabolic rate in all organs. It also increases the sympathetic nervous system activity, causing fine tremors and low heat tolerance. The thyroid hormone directly stimulates the heart, increasing the heart rate and the cardiac output as well as the blood flow. Now, when it comes to the pathophysiology, there are two effects that are there. We have what we call as the metabolic effect and the hormonal effect. Let's look at the metabolic effect first. Okay, so on the metabolic effect, the elevated thyroid hormone affects protein, lipid, and carbohydrate metabolism. Protein synthesis and breakdown are increased. However, breakdown exceeds build-up, causing a net protein known as a negative nitrogen balance. Glucose is also increased and the patient ends up with hyperthyroidism. Fat metabolism increases and the body fat decreases. Although the client has an increased appetite, food intake does not meet energy demand and the client loses weight with prolonged hyperthyroidism and the patient has chronic nutritional deficiency. Okay, now on hormonal effects. The high thyroid hormone affects the production of stimulating hormones from the anterior pituitary and the hypothalamus. In addition, thyroid hormone influences the sex hormone production in both men and women. Women have menstrual problems and decreased fertility. Both men and women with hyperthyroidism have an increased libido. Okay, so now let's look at the signs and symptoms. So one of the signs and symptoms is heart palpitations. Heart palpitations, they come about due to an increase in heart rate. Then we also have heat intolerance. This is due to increased metabolic rate causing fever. There is also nervousness, which is as a result of stimulation of the sympathetic system. Insomnia is also one of the signs and symptoms. This is due to increased metabolic rate. There's also breathlessness with or without exertion. This is due to increased metabolic rate and also an increase in oxygen demand. There's also increased bowel movements. This is due to increased peristaltic movements. So these are some of the signs and symptoms of hyperthyroidism. Diagnosis of thyrotoxicosis or hyperthyroidism. So to help you come up with a provisional diagnosis, one of the prominent clinical features that you are going to see is exophthalmos, which is simply the protrusion of the eyeballs from the socket. Then you're going to take history. So history is going to review that there is weight loss despite the patient having a good appetite. Then you're going to measure the level of thyroid stimulating hormone in the blood. And usually this you find it to be low. And it is due to the inhibition by high thyroid hormones. Treatment of thyrotoxicosis or hyperthyroidism includes two groups of drugs. We have the thyrostatic drugs, also known as the antithyroid drugs, and the beta blockers. So with the thyrostatic drugs, these are drugs that can inhibit the production of thyroid hormones such as carbimazole, 20 to 60 milligrams per day for 2 to 8 weeks. Then we have methimazole, 10 to 60 milligrams per day, which is given in 2 divided doses. Then we also have propylthiouracil, also known as PTU. This one, it is given 300 to 450 milligrams in 3 divided doses per day. So you need to take note that a very high dose is often needed early in treatment, but if a high dose is given persistently, patients can end up developing symptoms of hypothyroidism. So you need to take caution. Then when it comes to the beta blockers, many of the common symptoms of hyperthyroidism such as palpitations, trembling, and anxiety are mediated by increases in beta-adrenergic receptors on cell surfaces. So beta blockers such as propranolol, which is given 10 to 40 milligrams 3 times daily, or metoprolol, which is given 50 milligrams 4 times daily. Nursing care that can be offered to a patient with thyrotoxicosis or hyperthyroidism. What you should remember is that the patient is irritable and should not be exposed to depressing situations like a very sick patient. Therefore, what you should do is to nurse this patient in the side ward. The patient has heat intolerance, therefore should be nursed in a well-ventilated room to promote comfort. When the patient is asleep, use artificial tears to prevent corneal ulcerations. Offer a balanced diet to improve nutritional status. Patient also sweats a lot, therefore change the linen and also the clothing that are there to promote comfort. The patient may worry about altered self-image. So this worry is coming from that provisional diagnosis that we mentioned under diagnosis, which is the protrusion of the eyeballs from the socket. So what you need to do is to explain the condition to the patient to allay anxiety. Prop up the patient to promote lung expansion and relieve breathlessness. Allow the patient to rest to promote quick recovery. Do regular temperature checks to rule out fever due to increased metabolic rate. If the patient has photophobia, this patient should be nursed in dim light. Okay, so this is what I had for you in this video about thyrotoxicosis or hyperthyroidism. If you have any questions, leave your questions in the comment section below. Subscribe if you haven't subscribed. Like and share the video. See you in the next session.